Good afternoon. My name is Chrissy Davies, and welcome today to our podcast. I am here with a very special honored guest. I have Dr. Kevin Smith with us today, and he's going to be talking to us about regenerative medicine. Dr. Smith, I just would like you to take a moment and just introduce yourself and tell us a little bit about your clinic and where you're from and why you're so excited about regenerative medicine.
Sure. I'm Dr. Kevin Smith. I'm a board-certified anesthesiologist and board-certified in pain medicine. I'm from West Virginia, but I've been practicing in San Diego since 1991. So I've got over 25 years of interventional pain management experience in the area. I perform multiple injections pretty much everywhere, multiple joint injections, injections to include the entire spine, including the cervical spine, thoracic spine, and lumbar spine. Previously, we've always utilized steroids and local anesthetics for our treatments and our injections. And the medical community has become more concerned about the long-term side effects of chronic steroid utilization. So I began to look at other therapeutic options or other solutions that I could inject for a therapeutic benefit. So about 6 to 7 years ago, I started becoming interested in regenerative medicine techniques. And now I perform platelet-rich plasma injections and stem cell injections. I have 2 clinics. One's a satellite clinic in La Mesa at 5525 Grossmont Center Drive. My main clinic where I perform my regenerative medicine techniques are at 7525 Linda Vista Road in San Diego.
Okay, well that's wonderful. So you got 2 clinics in San Diego area, it sounds like. And it sounds like your clinic is offering regenerative medicine. So Dr. Smith, tell me a little bit more about regenerative medicine and really what exactly is regenerative medicine?
Sure. It's where we can utilize your own body tissue to promote healing and the regeneration. The platelet-rich plasma, or what we refer to as PRP injections, they're basically vesicles for growth factors. These growth factors perform a lot of wonderful feats. They can develop new blood supply, which brings more oxygen to the tissue when injected into the damaged tissue area that can promote healing. They can also act as antimicrobials to prevent infection. They can act as an anti-inflammatory. They can also recruit stem cells. And the stem cells come in and they can lead to more revascularization and tissue regeneration.
Wow. So it sounds like, our bodies are actually designed to heal themselves. So, could you explain a little bit more about how that works? I mean, if we already have these cells and these platelets already in our system or in our own bodies, why do we need to see a doctor to get our body to heal itself?
Yes, certainly you don't want to perform this in your garage, but so the platelets, how we obtain the platelets is we draw blood from your arm. We take that blood and we place it into a centrifuge, and that centrifuge spins the blood down, and we collect an area called the buffy coat, which is where all the platelets and the growth factors are. We take that and inject it into the damaged tissue. With the stem cells, we primarily obtain that from the iliac crest. Again, we obtain the blood from the iliac crest. We place it into a centrifuge. It spins it down. We collect the good stem cells from your bone marrow and inject it into the damaged tissue.
Okay, that is very, very interesting. So what if I have a blood condition or a past illness that prevents me from being a candidate for this type of procedure, or that I'm just not necessarily comfortable with having a bone marrow harvested from my iliac crest? Are there options for patients that are wanting, not wanting to go through that process?
Sure, there's a couple of options. There's amniotic tissue, amniotic membrane that contains growth factors and stem cells. There's umbilical cord blood that contains a lot of stem cells. These products are purchased from a lab. These labs get these products from mothers that have delivered babies. Essentially, these mothers are pre-screened. They're screened for illnesses and viral infections, and they can agree to give up these products at the time of birth. So once these mothers are screened, their babies are delivered by C-section, and the products are removed at that time. After the products are removed, they're stored appropriately, and then they undergo another battery of tests to make sure that it's a safe product, it's not going to cause any immunologic or allergic reactions, and we're not going to transmit any viral illnesses. There's some labs around that have been doing this for years, and they have a good track record, and they deliver safe products.
That is very interesting. And it makes sense that the amniotic tissue and the fluid and the cord blood, the cord has been providing life or sustaining life for that infant, until it arrives into the world. And so it's amazing now that we've been able to isolate that technology to use it for other people. It's amazing science. So I guess probably people are starting to get interested now and wondering what types of conditions are most commonly treated with regenerative medicine or for regenerative medicine.
Sure. In my clinic, we treat a lot of knee pain from osteoarthritic conditions, from knee injuries, anywhere from meniscal injuries to ligament injuries. We treat a lot of shoulder pain, again, from osteoarthritic conditions, frozen shoulder problems after you've had shoulder surgery. We also treat rotator cuff tears. We treat hip pain due to osteoarthritis of the hip and labral tears. We treat ankle and foot joint pain. We treat hand joint pain. We treat a lot of tennis elbow. We perform a lot of these injections in the lumbar spine now. We perform intradiscal injections, facet injections, sacroiliac joint injections.
Wow, sounds like you've got everything covered from the tip of our head to the tips of our toes. That's wonderful. So, I heard you talk a lot about labral tears and maybe a rotator cuff tear. After an injury like that, how quickly should I be seeking a regenerative medicine professional to help me with these symptoms?
Well, the sooner the better, especially if you're considering an initial surgery or another surgery. This is a therapeutic option that I can offer you that may prevent the need for any surgery. If surgery is not convenient for you to have at that time, it's a good treatment option. You may need a surgical procedure, but not be a good surgical candidate because of other health conditions. So these are all good reasons you should consider this therapy.
Very, very interesting. So are there other conditions that are being treated as well? I've heard about, some other autoimmune disorders that, may be being treated. I know a lot of this stuff is still experimental, but have you heard anything about any of those types of treatments as well?
Yeah, in addition to our current treatments, we're using a lot of, we're now starting to utilize some intravenous therapies, intravenous PRP and intravenous stem cells. There's some studies and current research being taken now where they're using this to treat certain autoimmune disorders like Lyme disease. They're using it to treat some central nervous system disorders like ALS, multiple sclerosis, cerebral palsy. They're using it to treat fibromyalgia and starting to utilize it to treat rheumatoid arthritis.
It sounds like there's a lot of hope and future in regenerative medicine. So are there a lot of studies out there, or I know that you just mentioned a few of them, and it sounds very promising, but are there some specific studies that you have read that have inspired you to take an active role in providing this medicine to your clinic?
Well, that's one of the issues as far as trying to get this treatment more mainstream. We have thousands of studies out there, but we need more, and we need We need more better design studies to make this therapy mainstream.
Okay. All right. Well, that makes perfect sense. I know that, with any early type of medicine, that it takes time to really get all the research out there. And doctors like yourselves are essentially pioneers in the space where you're, really offering these services to patients and getting amazing results very early, which is just fabulous. So if you come in to have one of these procedures, do you have to take a lot of time off? I'm sure a lot of patients are starting to wonder that now.
No, you don't. Usually you can return to work the next day. There may be some restrictions to extreme activities for a short predetermined period of time based on the procedure that we perform.
Okay. And then are these types of procedures, are they covered by insurance, or what is the protocol and the policy for getting paid for these services?
Yeah, unfortunately, it's not a covered benefit with any insurance company, but I think it's a good investment in your health. When you start thinking about insurance, there's a lot of unknown costs. There's your deductible. There are copays. There's loss of work costs because you try to get authorization to see a physician. That takes a period of time and you lose work. We also spend a lot of money on daily supplements, gym memberships, and personal trainers. And so I think this is a very affordable option and a good investment in your health.
It sure does sound like it. And you're right. When you compare what we spend on other things that we may not get results for either, but if we're looking to invest in our health, like you say, is like a gym membership. The investment is you pay for the membership and then you go in to get the results that you're looking for. And it sounds like you're trying to partner with your patients to help them get the best optimal results. Is that correct?
Yes, we are. We look at each patient individually and we try to come up with the best option for your problem. So this is a very personalized therapeutic modality.
All right. Well, I want to thank you so much for your time today. I know you have a full and very busy practice. I'm sure some of our listeners today would love to know how to find you and find your clinic. Would you mind just giving us a few details about how we can find you and reach your office to make appointments?
Sure. It's my main clinic is at 7525 Linda Vista Road, San Diego, California. The phone number is 619-398-2988.
Okay, I'm just going to repeat that phone number back. It is 619-398-2988. And then I also have your website up here, Dr. Smith, just for your convenience here. It's www.integratedpain.com, and you can find Dr. Smith and his team right there on that page, as well as with Facebook. And if you go onto Facebook and like their page, which is also Integrated Pain, you're going to be able to find out about more of these services that they're offering in their clinic. Dr. Smith, again, thank you so much for your time today. I think this information is just very exciting, and it's just very promising to know that we have other options available for our healthcare. And I do appreciate your time and look forward to having you on our show as a guest in the near future.
Thank you.
Thank you so much. Everyone have a wonderful day. Take care.